Welcome to another episode of Cutting Edge Pain Relief. Today, we're going to talk about a topic that many people don't really know all that much about, and that is something that is called Botox for pain relief. We're going to talk about how you can be able to use this type of treatment option for pain relief and not have to use other more novel therapies in order to be able to get this type of treatment. So first and foremost, we need to talk a little bit about Botox and give you an idea and a background. But before we do that, let's give you easier about what Botox can be used for. So when we're talking about pain, there's both FDA usages and off-label use. So FDA approved uses are the following. It can be used for migraine. It can be used for different types of spasticity. So that area where you have issues with muscle that really is causing pain with kind of that locked up sensation, which can occur from everything from the upper limb to the cervical region, otherwise known as the neck, to you having different problems with other muscles that can cause issues like TMJ and things of that nature. So there are also being some off-label uses for pain relief, such as osteoarthritis, myofascial, and peripheral neuropathy, all of which we're going to talk about today. So it's kind of a teaser for why you really want to make sure that you stick around for the whole context. For those of you who join us with consistency, like Jesse and Elaine, we really appreciate you guys joining in. As an aside, this is not a formal lecture where I'm going to tell you, okay, you have to keep your hands down. I don't ask any questions during this whole thing. If you got a question, shoot it. Be happy to answer it and deal with it just like we do every week. And what we want to do is to make sure that you understand the different options you have for pain relief, how to be able to punch pain in the face, and how to be able to get back to leading the life that you deserve. So today, what we're going to really talk about is the context of Botox. So when most people think about Botox, immediately what they start thinking about is different treatments that are going to be more aesthetics, meaning to try to be able to take out wrinkles or to be able to try to do other things that are trying to make people, quote unquote, better looking or pretty. The irony is the origins of Botox is completely the exact opposite of this in its entirety. So one of the very first documentations of Botox is from the 1820s. And it actually was by a German who looked at the context of Botox, and this is the original manuscript, which you're seeing right here, that talked about food poisoning from sausage. Okay. And so when you think about food poisoning and sausage, you're like, okay, never would have thought about that for doing things for wrinkles, right? So, and again, Cindy, thank you for also joining us. We really do appreciate you being with us. So when you think about that and where things have kind of gone to, we're really kind of like, wow, this is a completely different expectation for how it can be able to provide both aesthetic uses, meaning kind of for cosmetics and such, as well as how it can be able to provide value for pain relief. So Botox, as I'm sure you derived from what we just talked about, that manuscript, is a bacterium, right? And it has different mechanisms of action, but when we're concerned about traditional Botox for pain relief, what it basically kind of boils down to is the following. So we'll read through this script here and kind of give you an explanation, and then we'll show you what this means. So that way you don't feel kind of like, oh, these fancy medical languages, I don't know what the heck that means. This isn't made for me. And that's nowhere near the truth. We're going to find a way so that you understand exactly what it is that we're talking about. Okay. So as I mentioned before, it's a bacteria. Its action is by blocking something that's called the neuromuscular junction. And the way that it deals with that is it works on a specific element that looks at acetylcholine and how it's released. And so there's a protein that's called SNAP, like finger, quote unquote, SNAP, right? So there's a protein that's called SNAP25. Now, obviously it's an acronym, it stands for different things, but in a minute, we're going to show you what that means. And so what SNAP25 is, if you can kind of take a look at this picture, basically what it does is it prevents this acetylcholine from occurring. And acetylcholine is hugely important in terms of making your muscles work. So when you block that acetylcholine release, because Botox comes in and says, you know what, nah, we're not going to let this acetylcholine get out. It prevents that muscle from contracting. And because you don't have that muscular contraction, it allows for a number of different things. Aesthetically, it prevents you from having that wrinkle that you would have because you stopped that from occurring. But from a pain state, it stops spasticity. It stops a number of different things from occurring that can be related to pain. Originally, Botox was really derived from elements of both ophthalmology and plastic surgery that were looking at crossed eyes and other elements of how to try to be able to stop different visual changes and other things in that nature. And Botox, as it started developing, really kind of took into couple different routes, some that were aesthetic and some that were therapeutically intervened. So when you actually look at Botox, there's more than one product. So there are different types of products that exist out there with completely different names and usage. But at the end of the day, the indications have some degree of similarity. So if we were to kind of give you an idea about, so what is Botox and how is it approved differently depending on the dynamic, it look a little like this. So if you look at traditional Botox, which is a type A component, it was originally approved in 1989, and it's for a whole host of things that you can see. So among those include migraines, different types of that spasticity that we talked about in different parts of the body. There's a different one that's a type B that is used predominantly for just cervical dystonia. And then there's other elements that are kind of a blend where they have brand names that are utilized in different countries like the UK or Germany. So when we traditionally talk about Botox as medical practitioners that are looking for pain relief, probably its biggest and most well-known context is within the context of headache. And for many patients, they may not have heard of that. They think, well, I'm thinking about Botox and I mentioned, hey, we're going to maybe do Botox for you. They're like, what are you trying to say? You think that I need Botox? And what we're talking about is not from an appearance. We're talking about how can we be able to make those tension type headaches, those migraine type headaches better by causing those muscles to not be contracted. So when we take a look at what the traditional injection sites are for Botox, they look like the following. So if you were to try to be able to alleviate the context of a migraine, you're placing really, really, really small needle, like a tuberculin syringe needle, so something like a 2730 gauge, into the areas that you can see with kind of these little orange circles. And note, it's not just within the face and above the ear and the back of the head. It also goes down into the shoulder blades too, because there's an interconnectivity of those muscles with the context of your overall pain. So when we use migraine treatments like this, it can help reduce medications that you sometimes would be on, or maybe even be able to stop those medications completely. But frequently that Botox piece, the sexy part about it is that you can get it done and it will last you for about 3 months or so. And as we saw within that original mechanism of action picture, when we saw it dealing with that protein that's called SNAP25, if you recall, those neuromuscular junctions don't come back automatically in terms of acetylcholine release. So we have a question that's coming through. And as I said, I want you guys to ask questions the whole time through. There is no question that we won't look to handle or deal with. So don't be shy. So that one question that came through was a question of, so will this potentially help for my back pain? So first and foremost, one of the things that we got to do when we talk about this is figure out how is it going to be a fit for you, right? So, and what I mean by that is one of the very first questions that I get when we talk about different types of innovative type procedures, is it covered by insurance? Right? And that's just the honest truth. I mean, we could talk about all the fancy stuff that we want to, but really we got to find ways to be able to enact it. And for this, one of the things that's key is it going to be FDA approved? If it's not FDA approved, insurance traditionally is not going to cover it, right? So those are things that we have to kind of assess, evaluate, and understand. Now, taking a step back, and we talk about, is it going to be potentially useful for back pain? Well, it kind of depends on what's causing the back pain, right? And for individual patients that are our patients or not our patients, one of the things that we won't do is we won't put your business on blast. I think that's a much more kind of individual conversation, but I can speak in a much broader nature, right? So let's say that you have back pain is being caused by a disc issue or stenosis or facetogenic issues. Those things, to back up a second, for those who may not watch our channel with frequency, so the disc may cause us to have some degree of back pain that's just within the back, so axial in nature, that really is going to be worse when we sit for a prolonged period of time. If it's facetogenic, is that it's coming from the joint that allows for us to be able to have that bend, that twist, that's typically worse when we go from a seated to standing type position. Or if it's coming from potentially a nerve, you might have more of a shooting type pain, burning, traditionally worse at night, right? We're going to talk a little bit about Botox and its use in different functions of other areas, but let's say that we're focusing predominantly on muscle. It depends on how the muscle is impacted, and if it's impacted indeed by some of those things. So could it be? Yes. Could it not be? Yes. We don't know that yet. It's very dependent upon the individual case. Outside the States, are there some innovative uses of Botox that really are kind of pushing the envelope for traditional treatment? Yeah, and the upside to it is, particularly within the axial spine, there's not a lot of downsides to trying some of these things, depending on the theorem of how you consider it. And so that's one of the reasons why you kind of see me having this speculative face, right? Because there's not a lot of good randomized controlled trials for a back pain assessment and analysis. I guess the thing that I would say is, if you're having a spastic quality, and that is one of the contributing causative agents, that might be something that gives you benefit, perhaps. But you got to deal with the hurdle of, number one, how are we going to acquire it? Number two, how is it going to be paid for? And number three, is it really going to be the fit for you, and trying to avoid any other type of side effects? So hopefully that answered your question. As we're talking about Botox a little bit more, in addition to us talking about headaches and spasms, one of the things that we see that is one of those off-label uses is one of the things that I mentioned earlier, and that is the following. So intra-articular Botox and osteoarthritis knee pain, right? And so how in the heck is this potentially working? So this was a study that, as you can see, was done in Scandinavia, that was from a number of years or so ago. But what they found was the following. They found that it actually gave some degree of benefit. So if you read in conclusions, and I'm going to interpret this to traditional layman's English, it says intra-articular Botox given to patients with nociceptive knee osteoarthritis reduced pain sensitization together with improvement in both pain and function. We're going to read what the results are in just a second or so. But at the end of the day, what that really means is the following, is that it was able to help some knee pain, but it's not FDA indicated, which means that it's probably not going to be covered by insurance. So that's when we start talking about what's the value for the person and how much of a difference it's going to make. So when we delve into the results for 1 second, one of the things that we see is that they looked at a couple different groups, and the groups they assessed at 9 and 10 weeks and 12 weeks. And what they were able to do is that they saw that the need for something that's called a rescue medication, meaning in medicine, in order to be able to deal with pain, was reduced, particularly at weeks 9 and 10. And they saw that there was significant improvement in terms of overall knee pain. And the upside to this is that we're not talking about doing some major treatment that would necessitate big needles or surgery or anything along those lines, but that maybe we can approach this from a different context, from a muscular context of trying to be able to deal with the components of the pain, right? So let's take a look at another element in study and kind of give you some insight, and that is the following. So is Botox useful potentially for nerve pain? And one of the things that this study looked at, which was in the Lancet, a British journal, which was the safety and efficacy of repeated injections of Botox in peripheral neuropathic pain. And it was pretty well done. It was a randomized, double-blind, placebo-controlled trial, which is one of those things that we really want. And what they found was, when they looked at this almost a decade or so ago, that they saw 2 administrations of Botox toxin A, each of which comprised several injections, had a sustained analgesic effect against peripheral neuropathic pain. Several factors, such as the presence of allodynia and a limited thermal deficit, may be useful in predicting treatment response and should be investigated further. So what does that mean? What that means in regular English is that, so for nerve pain, Botox was able to provide some degree of benefit. So that shooting pain, that tingling pain, that pain that you feel where you kind of feel like the ants or water that seems like it goes down your leg, your back, your arm, those type of pains, Botox were able to provide some degree of benefit. And so when we talk about innovative treatment and options and how to be able to look at this, it actually may lend itself to some pretty innovative thought processes. In full disclosure, one of the reasons why we looked at this, besides our office, providing Botox for traditional migraine utilization, is that there's been some really interesting speculations of how one might be able to use this within the context of regenerative medicine to be able to help patients, particularly when you have a muscle that has a very tenuous position. Can you be able to decrease its stressors by possibly using Botox when you're repairing it with different cellular orthobiologics, whether it's stem cell or whether you're trying to be able to recruit healing factors there through different types of injections that you would use from that person's body. And instead of that person kind of not thinking about, well, I have to take care of my shoulder, I have to take care of my knee and not push it and stress it too much, you can focus maybe on that specific muscle. And if it's a partial tear, prevent that partial tear from worsening. So there's some really innovative thought that's out there by some leaders in the field and progressors of how to be able to treat patients to get a better result by saying, okay, how can we be able to do this better? So we have another question that says, I have a friend who has knees that are bone on bone, and would this help her with her pain? And again, without being too political in trying to answer this question, what I would say is the following: is I really can't speculate about any individual person's what their response is going to be. I think any doc that does that probably would say, well, I would probably say about that doc is, how do you know? First and foremost, we have a few studies that give us some degree of clinical significance, but that doesn't mean it can be universally extrapolated to everyone. One. Two is it depends on the severity of the disease. Bone on bone sounds pretty severe, but not every surgeon's classification of bone on bone meets with traditional bone on bone classifications. So with trying to say that in the nicest way is different people see it differently, right? So I need to kind of see radiographically what she's dealing with. And then after that, also make a determination about what else has been done and what makes intuitive, reasonable sense. But at the end of the day, one of the things that we want to make sure people understand is that Botox is a treatment. It's not a treatment just for wrinkles. It's a treatment potentially for pain. It can help you for headaches. It can help you for TMJ. It can help you for muscular spasticity, specifically in the upper limbs. And then off-label uses is that may be able to help you for different types of joint pains. It can help you potentially for myofascial pain, which I know people are like, what the heck is a myofascial pain? Myofascial pain is going to be muscular type pains that can give you an issue that historically aren't all that well treated by traditional orthopedic responses or treatment options that are out there. And then in addition to that, it may be able to help you for peripheral neuropathy and being able to give you benefit that you otherwise wouldn't have. Right. So those type of treatments are things that historically we haven't really talked about within the context of how can we help you find ways to get benefit through mechanisms that you really don't have normal discussions about. Traditionally, it's steroid, surgery, or just kind of suck it up. So what are some of the other questions that are out there from some of our individuals? Is, would age be a factor in a person's results? To be frank with you, not necessarily. Botox has been used in a whole host of different age groups, actually, not only from the more senior in our population or more mature. It's also been used for individuals who are younger, as a matter of fact. So I don't think that Botox is going to give us an issue. What we're really looking at is that context of, again, the neuromuscular channel, right? So that junction, if my fists are representative of kind of that communication, in order for the muscle to contract over here, the nerve has to release that acetylcholine that gets to the channels and then causes this to actually be able to contract. If you don't have acetylcholine release, then you won't contract. And what we want in this context is for the muscle not to contract. So those are things that we really need to have some understanding about and figure out whether it's going to be potentially beneficial for you. So other questions that you have, please shoot them out to us. Be happy to answer them for you. In terms of being able to use Botox for other treatments besides the aspect of head, neck, and face, it really kind of depends on the insurance and what your insurance will allow for you to be able to do. To me, I think there's different ways to be able to deploy that medication when we're doing it in other places than just the face and neck, whether we're using ultrasound guidance, whether we're using it within the context of EMG. So EMG is where you place a needle within the context of a muscle and you see whether you have aberrancies in terms of how that neuromuscular junction fits into the muscle. And you can make a determination, is this the altered area that's causing some degree of pain? And if so, you can be able to inject that area to be able to get a good response. We talk about regenerative medicine and how it can be utilized. It certainly is a revolutionary technique to say, how can we in essence provide a medicinal splint? Instead of us having to wrap you in a splint, maybe there's a way for us to be able to kind of immobilize, but be specific about the muscle that we want, quote unquote, immobilized, so that you have less challenges and issues that you otherwise would have. Well, again, for those of you who joined us today, as you do sometimes with some degree of frequency, we really appreciate you joining us. It's always a pleasure to have you take time out to listen to us be able to kind of meander on about new topics and new innovative therapies. And so I applaud you guys for listening to this. And I really do appreciate your questions. For those of you who didn't think of a question during this live stream or you're watching at a later date, leave it for us in the comments, whether you're watching this on YouTube or whether you're watching this on Facebook, and let us know what are some of your questions about Botox or other treatment options that you're interested in. If you follow us on our YouTube channel, by all means, check out one of our new videos that's coming out, I want to say in probably about 2 days or so, that's talking about how neck pain can cause headaches and make it worse. Really innovative topic and discussion that really kind of gives us some insight. For those of you who are not on our YouTube channel, which will let you be able to see this at a later point in time, if you take a look at the banner below, it tells you where to go to Cutting Edge Pain Relief so that you can find what all our different videos that are out there to talk about everything from stellate ganglion block to how occipital neuralgia can be problematic in nature to other issues that really focus on the head and neck. But actually, we talk about things much broader than that, from things like low back treatments that prevent you from needing surgery to regenerative medicine treatments like stem cells and PRP and other orthobiologics to minimally invasive procedures to really how to be able to have a good diet that makes sense and prevents you from having issues. So if you have questions, please send them in, let us know. We will do our best to answer them going forward in the future. And again, what we want to do is make sure that you understand that you have options. And those options aren't just limited to steroid surgery or suck it up. And what we want to be able to do is to help you win this fight against pain. And more importantly, be able to also improve your function. Because at the end of the day, it is a fight. It's a battle. And this is not something where we're going to just roll over and let pain take over. But more so, we're going to teach you how to be able to punch pain in the face and get back to leading the life that you deserve. Thank you and have a great day.